Good afternoon, everybody. Jerry Frostick with J&A Racing. Very fortunate to have Dr. Haynes. I really appreciate you being here and taking your time. And really, I think everybody's aware that Bon Secours Orthopedic takes care of all of our runners, all 7 of our events. But there are 45 other weeks in the year that we need them to take care of them too, so you can come enjoy our events. And I think a lot of the things that we hear and what we've asked Doc to talk about, we have some knees. When we're running and we get some knee pain, how do we know, do I need to come see you? Because I think where we appreciate your time, we'd really rather see you out on this in the town, not in an office. So when do I come see you?
So when I see my runners, most commonly, they end up with anterior knee pain or kneecap pain, all right? Mainly as they run, they stress their kneecap much more, particularly if they go uphills or downhills. They end up putting 3 to 5 times their body weight through their kneecap. So they end up stressing the kneecap, stressing the tendon that's with that kneecap. What balances that out is the more strength you have in your quadriceps, all right? The more you battle it, the better you do, and the longer you can run. If you run out of power in your quadriceps, then the stress is there when you run. It has to go somewhere. It's going to go to your kneecap, it's going to go to your tendon, or even in the lower leg and the shin, all right, because the muscle's no longer protecting you.
So, because back in my day, weights, you didn't need to lift weights, you just needed to run. Does a stronger quad, would you recommend doing some quad strengthening?
I think the quadricep strengthening is a great idea. You don't want to do just quads. You have to balance it with the hamstrings. But of the two, I think the quadriceps is more important to hold your kneecap and stabilize your kneecap.
Okay. Well, and then, because I know especially you are a surgeon, I think as a runner, the S words scares us.
Right.
And we also try to self-diagnose ourselves, and if my knee is inflamed, my biggest fear is, oh my gosh, I need to get surgery.
Right.
What should I do if I have some inflammation under my kneecap?
Right. So what I prefer my friends or any runners to do before they come see me, all right, is a Aleve Advil, or over-the-counter common anti-inflammatory agents that help settle down any inflammation you may incur. 2, obviously icing when you get done with the run, I think is important. Warming up well and stretching well, because a lot of times we don't do that, all right? I'm as guilty as the next guy. It's like I go and I don't pay attention to those details. If you do well, then you don't need to pay attention to those. But if you start getting into trouble, you got to start following the letter of the law and saying, okay, I need to be better with stretching, continue with my strengthening, use my Aleve Advil when I need it, and ice when I get done.
So knee pain doesn't automatically mean a running career is over, I have to get surgery. We can initially try to correct it or fix it with ice, some rest, ibuprofen.
I would tell you, of all the runners I see in the knee pain, 1% are surgical.
Right.
They're really not a big deal.
And I think that's important for us to remember, because we always think the worst thing. I mean, if my knee's hurting, it's, oh my gosh, my career's over, and it's really not that serious.
I would tell you the things that I worry about, all right? If your knee swells, that's distinctly abnormal, all right? That should not occur. So if you're running and you get the end and you look down and your knee looks like a basketball, looks like a grapefruit, and it doesn't look like your other knee, then that's a problem. That's a warning shot. Buckling, in other words, your leg goes along, even if you're not running and it kind of gives out on you, that's a problem. And the last one's pretty simple, it's called locking. In other words, your leg doesn't straighten or doesn't bend, it kind of gets stuck in one position. That means there's something in there floating. Those almost herald a surgical intervention, all right? Not always, but those are my worries. If you don't have those, then it really is back to everything I've already talked about before.
And then, how do we, so my knee's swollen, I've iced it, I've used ibuprofen, I've even taken off for a week, and it's still really bugging me.
Yeah.
How do I call it your outfit? How do I get in touch with you?
Right, so if you do all the right things, and generally a week is about right, you kind of modify what you're doing, then you gotta call me and you just call straight to my office and I'll be glad to see you, and we'll see if there's something else going on.
Okay.
All right.
Perfect. Well, I think what us as runners like and trust dealing with someone else that's into fitness too, because I think you you understand the mental part of it, that we're doing this as much for our psyche as for our fitness, and don't want to hear, well, you need to quit running. I think we'd like to talk to a doc that wants to get us back out there running.
I agree with that completely. So I'm not a one that says, I want you to sit on the sidelines just with my joint replacements. I want my patients back running, all right? I want you to, and it's not like you do this and great, now you can go sit on the couch or go bowling, all right? You wanna get back to doing what you wanna do.
Perfect.
All right, very critical.
Perfect.
If they have pain in their knee, we went back to it, that's the front part of the knee and the kneecap. If they have pain on the sides of their knees instead of in the front of their knee, then that usually also signals something different, because it could be a meniscus tear.
Mm-hmm.
My meniscus tears, which is a little shock absorber cushion between the knees, sometimes are pretty confusing, all right, because they'll have pain, and my runners seem to be a little different in that they could have a torn meniscus, and it acts like a kneecap. All right, so sometimes you treat them and they go through this process and we try all the right things, and then all of a sudden they just don't get better. A lot of times you do an MRI on them and they'll end up with a meniscus tear, which is, they tend to tolerate, all right, but it still kind of aggravates their kneecap. So it's really more the tear that's causing the kneecap to get irritated, so you gotta fix that versus having to deal with the kneecap.
And how about the IT band? We always hear IT band, IT band. Is that just inflammation? Is that?
The IT band stretches from just below your knee up to your pelvis, all right? So it's actually the longest piece of tissue in your body.
Huh.
All right, so stretching it is critical, because the top part of your IT band is actually muscular. So when you run, this thing tightens as you run. So I see it a lot of my ladies, because ladies get that more commonly than men, all right, because they're built differently than us. And it's really hard to stretch. So I find if you stretch regularly throughout your day, you do much better with that than if you just stretch right before you run or right when you finish running. Some of my people end up having to walk because of it, and mainly if you stretch throughout your run or throughout your walk as well as throughout your day, you do much better.
Well, again, I think it's great info, and I think more than anything, I'd like everybody to realize that we'd like for you not to have to come see him, but if it's bothering you and keeping you from out there, this is the kind of people that you want to go see, because his goal is to get you back out. So I really appreciate your time. I know you're a busy man, and thanks for all you do to keep us every day healthy.
All right, thank you.